Good morning friends, I am Dr. Jagdish Pusa, Consultant Orthopedic Surgeon, TX Uppal branch. Today we are going to discuss about a very important topic which has gained popularity in recent times because of COVID. So the topic is avascular necrosis of femoral head. Avascular necrosis is nothing but it is a death of the bone tissue due to lack of blood supply. The important reasons behind this avascular necrosis of femoral head is the first important is steroid intake, the trauma around the hip joint, especially the neck of the femoral fractures and intertrochanteric fracture sometimes. And the third reason is excessive weight, that is obesity, which is also the growing important epidemic these days. And fourth important is excessive intake of alcohol and smoking. Some other minor factors are also there like chemotherapy, viral infections and idiopathic reasons. So what exactly happens in avascular necrosis? So due to several reasons where the blood gets thick and slowly the supply to the femoral head stops at some point. So at that point the bone tissue slowly starts getting destroyed. So the head of the femur becomes soft and the shape of the femoral head changes, it shrinks. So there will be incongruity between the acetabulum, that is a cup, and the ball. So that leads to more and more wear and tear of the hip joint and eventually the complete hip joint gets collapsed. So this is the thing happens in the avascular necrosis of femoral head. So what are the treatment options available for this? So the first and foremost thing is you need to prevent this. So you need to take your steroids if at all you are using steroids due to any other reasons like asthma, chronic skin diseases or viral infections these days like COVID or some other non-COVID infections also they use lot of steroids. So if you are using steroids due to any disease reason, so please visit your orthopedic surgeon at frequent intervals and get your hip joints checkup at a routine, right? If you are not using any steroids, then if you have any complaint in the hip joint like pain or any stiffness or any restricted movement, do visit your orthopedic surgeon immediately and get your hip checked for avascular necrosis, because the treatment result depends entirely on at which stage we diagnose it. Okay, coming to the staging, it occurs in various stages 1, 2, 3 and 4. In the initial stages, that is in stage 1 and stage 2, where the femoral head is still incongruous with the acetabulum, still we can prevent the staging, that is from stage 2 to stage 3 we can prevent the progression of the disease and sometimes we can even arrest the stage also at that stage. Right. In advanced stages like in stage 3 and stage 4 where the femoral head shape changes and there is a wear and tear in the hip joint, at that stage we need to go for a total hip replacement. But in the earlier stages there are other treatments available like we can give some painkillers and we can reduce the pain. We can do some core decompression, that is the dead bone we can remove through a small channel by drilling a hole into the femoral head. We can remove all dead tissue. And recently there are so many things that have come in, that is after removing the dead bone we can inject some stem cells into the canal and that leads to new bone formation. But still this is under research study still, but few patients have benefited with bone grafting and stem cell therapy after removing the dead bone. If we inject the bone cells and bone graft into the decompression canal, so they have benefited with that procedure. So please visit anybody who has affected with COVID recently, anybody who is using steroids over a period of time, and people who are suffering with hip joint pain, recent onset of any hip joint pain, do consult your orthopedic surgeon immediately and get a hip joint checked for avascular necrosis, because earlier we diagnose, the better will be the result. Thank you.